Maria Holder Diabetes Center.
The only difference between a glass of orange juice and a glass of Coke is that the orange juice has some vitamin C in it. They both have almost the same amount of sugar.
It's Saturday morning, 9 o'clock, which means it's time for 15 diabetic friendly minutes on VOB 92.9 FM, all with the compliments of the Barbados Diabetes Foundation.
I was wondering, Skipper, what is actually happening in today's show? I'd like to know.
Let's find out. What are you doing today, Dr. D?
Very quickly, I'm just going to highlight some of the syndromes of menopause.
Listen as Dr. Diane Braffitt expeditiously addresses that important topic for ladies.
Our whole management system is about creating self-management skills.
Nurse Tracy talks about how you can self-manage your diabetes.
I'm here now, Tracy, for donkey years.
And Dr. D has a message for Hypertension Day.
I hope it don't raise my blood pressure.
All this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that's not going to raise your blood pressure because they're always looking out for you financially. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
A happy Saturday morning, VOBers! This is Speeder Boys here, once again to talk about an institution with a peripheral of health services, vascular screening, eye screening for diabetic retinopathy, diabetes specialists, doctors and nurses. Whether you are diabetic or pre-diabetic or just want to check your health numbers, you can find it all at the Maria Holder Diabetes Center located in Warren St. Michael.
Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
So let's see who's in the winner's circle this morning. As the Diabetes and Hypertension Association of Barbados, they're holding their wellness conference, Live Stronger, Longer Blue Wellness, on Monday the 18th and 19th at the graduation tents at the Cave Hill campus. And we asked the question last week, remember, where you had to go to our Diabetes Foundation Instagram page to answer. And we have a winner. The winner of 2 tickets is Janelle. She's not giving her second name because she doesn't want you to turn and beg for her tickets. Congratulations, Jonelle. Remember, the wellness conference starts at 7 a.m. on Monday the 18th and will be open to the public from 4 p.m. to 8 p.m. so you can go and check that out. As we now go to check out Dr. Diane Braffitt, and she is speaking on a topic that is very important to ladies. So let's hear Dr. D.
Now we're moving on to that phase, perimenopause to menopause, okay, and postmenopause. So perimenopause can actually start 10 years prior to the actual menopause, and this is when the periods actually stop for a full year. And in the perimenopause, your hormone levels are fluctuating downwards, sometimes in a slightly unpredictable way. And during the menopause, the levels are even lower, and postmenopause, you have sustained low levels of hormones. And these sustained low levels of hormones will include things like estrogen, progesterone, and yes, ladies, even your testosterone. Okay, so remember, ladies, although we're females and we think of female hormones, testosterone is also important at low levels for good general health. Okay, so make sure you discuss these things with your healthcare providers so you can get screened early. There are definite benefits to actually starting hormone replacement therapy quite early. And remember, hormone replacement therapy has changed greatly. Nowadays they're using rub-on skin gels and other things like that have less side effects. There are some people who might not be able to take it because of coexisting medical conditions, and so therefore you discuss that with your healthcare provider. You do not have to suffer. Very quickly, I'm just going to highlight some of the syndromes of menopause, because these are things that we see people suffering with and things that can affect somebody's diabetes. So number one, you can get first of all things like what they call the vasomotor symptoms, and we know these ones. These are the hot flashes, this is the anxiety, this is the palpitation. So man, unfortunately, yes, this is real. It's actually a real thing. We're not making it up, okay? And then you have the genital urinary symptoms of menopause, where you may get vaginal dryness, urinary frequency, you may have problems with pain during intercourse because of vaginal dryness, etc. This can be treated as well. We also have the musculoskeletal symptoms of menopause, and that is going to be things like your joint pain, your ligament stiffness. If you wonder why all of a sudden you got all these pains you never had before, it could be menopause, okay? We have the metabolic syndrome of menopause, and that's where this becomes relevant to obviously us directly with diabetes, and that's an increase in blood sugar, increase in insulin resistance, increase in blood pressure, cholesterol, and increase what we call cardiovascular risk or cardiovascular disease. Now, it has been shown that early hormone replacement can actually reduce the risk of this. The best benefit is when it's started early. However, when women are older, say over the age of 60, there is still some benefit, but once again, you have to discuss with your healthcare provider whether this is appropriate for you. We also now have things like sleep disturbance syndromes, insomnia, often triggered by hot flushes or night sweats, and of course this can impact your blood sugar and it can cause daytime tiredness, difficulty concentrating. We have the psychological and what they call the cognitive syndrome, and this is the brain fog. Brain fog is a real thing, and it may almost feel like you're getting the early stages of dementia with memory and concentration difficulties, the anxiety, depression, irritability. And finally, if you're living with an autoimmune condition, yes, perimenopause and menopause can worsen some of the symptoms of autoimmune diseases such as rheumatoid arthritis and other autoimmune diseases, and it can also worsen the symptoms or the manifestations of it. So ladies, I hope this has been helpful to you, but what I do want to remind you is that if you're going through any of these phases, once again, get the support of a good healthcare provider. That's number one. Number two, understand what your treatment or options may be. And number three, get on board the lifestyle. Lifestyle makes a massive difference to how menopause can affect you in some cases. Remember, a really healthy diet, reduce all those processed foods, limit your sugars, okay, limit alcohol or stop it altogether, alright, and then also finally thinking about things like sleep, thinking about things like managing anxiety, and be patient with yourself, okay? We have to learn how to be more patient with ourselves and sometimes slow down. That's very important.
Thank you for that important message, Dr. D. As we go from a doctor to a nurse, International Nurses Week recently concluded, as we now go to Nurse Tracy Bushell to tell us about the state of diabetes in Barbados.
A lot of the referrals that we get, it's actually quite amazing how little they understand and education that they may have received in the past. So when they come to see us, and my role is key, is education. That's my bread and butter every day, as well as just reviewing patients, managing medication and everything. So it's actually all the disciplines that we have. Our whole management system is about creating self-management skills for these clients to help prevent all the long-term complications that are associated with diabetes. So they would go around all the disciplines during their 6-month program. Hopefully at the end of it, they will have the tools, the information that they need to be able to continue forward and live a very healthy life and be able to manage their diabetes well. I think one of the things that actually did cause me very much concern when I first came to Barbados us over 12 years ago was the amount of problems that we have with, people have at-risk foot and foot ulcers. And, we see many of those patients come through the diabetes centre. And it's not just about their wound care, because it's the whole multidisciplinary team that continue to educate those patients to help make sure that it's not just about their foot ulcer, it's about keeping their diabetes well controlled as well.
Thank you, Nurse Tracy. As we go into our Saturday song of the day, and this is a song for National Nurses Week, the late Gregory Isaac with Night Nurse. Compliments the Maria Holder Diabetes Center and Republic Bank.
Tell her try your best just to make it quick. Go much into the sick.
Maria Holder Diabetes Center.
Cause there must be something she can do. This heart is broken in two. Tell her it's a case of emergency. There's a patient by the name of Gregory. Night nurse.
The Maria Holder Diabetes Center.
Did you know that Sunday the 17th of May is World Hypertension Day? Hypertension is an equally important medical condition that we need to consider in our society. And why? Well, first of all, hypertension is more prevalent in people of color. And in Barbados, unfortunately, over 40% of our adult population has hypertension. But what's even more alarming than that, or what should be made note of, is that in the diabetic population, rates of hypertension become even higher. Over 60% of adults living with diabetes will have hypertension. In the Maria Holder Diabetes Center for the Caribbean, we actually see rates as high as nearly 80% of our population having hypertension. Hypertension is a topic we have discussed many times before, and although sometimes preventable and other times not, it is treatable. And it is very important that persons treat themselves to target blood pressure as much as possible. So every household should have a blood pressure machine that's properly calibrated, that measures the blood pressure from the arm, and persons within the household should know how to check their blood pressure correctly. So let's stick with the theme for the year, and that would be getting screened, early detection, treating properly, treating to target, and avoiding the unnecessary complications of high blood pressure.
Cutting-edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
Remember, diabetes isn't just about sugar. It affects your heart, kidneys, eyes, and mind.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how to get your simple digital eye screening done for just $100. But members get 10% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you.
The Maria Holder Diabetes Center.